Hello everyone, we are Team Syntax Summarize and another problem statement of SIH 25001. We are building a smart community health monitoring and early warning system for waterborne diseases for the people living in the rural Northeast India. The solution we are presenting is quite simple and powerful. First, when patients visit the local health centers, their basic health data is uploaded securely. Next, our AI acts like a health detective, spotting early warning signs in both patient records and satellite images long before the doctor scan. Finally, if the system predicts a high risk of an outbreak, it instantly sends out life-saving alerts to patients, NGOs, and health workers. Instead of thus reacting to a sickness, we empower the entire communities to prevent it. The magic is how we make this advanced technology accessible to everyone. Behind the scenes, we are using Google Earth Engine, Sentinel satellite imagery, and AI forecasting models. For the user, it is incredibly simple. A farmer in the remotest village doesn't even having a smartphone. He receives a critical health alert as simple as a SMS in his local language right on his basic phone. Simultaneously, NGOs and health workers see visual dashboards and hotspots map, allowing them to mobilize resources precisely where they are needed the most, because we ensure that no village is left behind. Isn't a complex, expensive system. Its strength is sustainability. We build upon what already exists, the health centers, the local NGOs, and the mobile networks that everyone uses. This makes our solution a low cost, highly scalable, and built for the long term. With our project, we aim to achieve 40% faster outbreak detection, 70% vaccination coverage in the rural communities, and 30% reduction in crop loss from pests and floods. Along with that, 25% increase in timely pest and disease management, 60% villagers receiving early warning via SMS, and 1000 plus health workers and farmers empowered with real-time data. But the most important metric isn't the data, it is the community's trust. When a family gets an alert that keeps their child safe, it restores their faith in the entire health system. This means fewer funerals and more children going to school healthy and thriving. We have built more than just technology, it is a seal for protection for the rural communities. For the first time, these villages won't just be surviving seasonal outbreaks, they will be staying ahead of them, hoping for a healthier and safer tomorrow. Thank you for listening to my presentation, everyone. And now I would like to demonstrate a prototype of the project that we have just built. So this is the opening or front web page of the website that we have built. We have to develop it much more, but this is just a prototype. From here we have two options. We can either go to the patient login or the healthcare login. Let Let me show you the patient login system first. We log in, and here we have the patient dashboard or the patient panel, from where each patient can look after his upcoming appointment, his medicines prescriptions, health status, check that if he has any active diseases or not. He can also check his medical reports and prescriptions. Also, we are providing a doctor chat so that the patients can have medical assistance even at late night when there are no possible doctors out there. And of course, the notifications part to alert our patients of the disease outbreaks. Then we have the healthcare login system. This healthcare login system, let me just access it. As you can see, we have logged in. This healthcare login system would be accessed by the admins who would be working at the community healthcare centers. This dashboard empowers the admin to upload the patient's data onto our securely managed database. And from this and from that database, our AI would predict the outbreak risk of a particular disease. We are also providing a mapping feature that would help our personnel from the healthcare centers and the NGOs to visually map out the points where the disease outbreak can be maximum. For now, we have only incorporated the data of each district in the northeast states, but our plan is to scale it up to each and every remotest village of our country. And once we have the data from our AI, we can plot the data on the map and we can find out the regions for the disease hotspots. Let me just demonstrate you how the map works. For example, we have taken Arunachal Pradesh and we have done get information, and we can see that it gives us all the details of the capital, the districts, and also the types of diseases that can spread here, the most common type of diseases of the basic data that we have found. Once our AI is integrated, we are also planning to show the disease hotspots in red. Like for example, if here the disease outbreak is more, we want to show the show it in red so that the disease outbreak is symbolized and our NGOs can go and take actions there. Apart from that, we are also making an admin dashboard for the NGOs so that they can also monitor their operations and all the other things that they need. Like, for example, we have done a basic data prototype to show like polio awareness, blood donation camp, and water sanitation drive. They can check, schedule, and monitor all the operations that they perform, and also they can receive the alerts from the admin of the healthcare community on this dashboard. So this was our project, and thank you everyone for listening to my explanation. Hoping for a safer and healthier future. Thank you.